Good morning, everybody, and welcome to Policy and Practices webinar today. Just while we're waiting to view the start screen, Deven's going to share his screen with us now. You're very welcome to our webinar today. This webinar is titled Work and Health Programme, How You Can Stand Out. Today, the organiser is Policy and Practice, but we're delighted to be joined by two other speakers, Tony Wilson from the Learning and Work Institute and Anne Gregory from PublicCo are joining Deven on today's webinar. Deven, if you want to share your screen, we will be able to get the webinar started. And just while Deven's doing that, that's fantastic, Deven, thank you. Just while we're doing that, and before I hand over to Deven to take us through the agenda, I just want to do a little bit of housekeeping with you, if I may, just to get us started and ensure that any late attendees don't miss out. The housekeeping then, if you could see the panel on your right hand side, if you could find the little icon that is a hand and click it, that will show me that you can hear us perfectly. Give us a little wave and let us know. And while you're doing that, please think about the questions that you're going to be asking. In the same panel, you will see an icon for questions. Click that and you can type in your question for the presenters. Please do that throughout. There will be a poll towards the end of the webinar, and there will be a very short survey at the end just to give us some feedback. We'd really welcome your input on that. We aim to have you on your way, certainly by 12:30. And that's all the housekeeping. Thank you very much, everybody, for letting me know that you can hear us. That's fantastic to see you all there. And without further ado, over to you, Deven.
Okay, thanks a lot, Janet, and thanks to everyone for joining us today. What I thought I'd do is just briefly introduce the agenda. We'll introduce ourselves as we talk through. As Janet mentioned, it's great to have Tony Wilson from Learning and Work Institute and Anne Gregory from PublicCo joining us today. I thought what we would do would be to kick off based on the questions and comments he had with Tony just introducing the Work and Health Programme. Because I think that'll be a really definitely key for those people that submitted responses to the questions upon registration. Then I think what Tony's going to do is talk a little bit about the performance offer and how the numbers stack up, i.e., is it going to be possible to take part in this program and still deliver a profit and certainly not make a loss, and how can you best do that? Then Anne's going to come on to talk about top tips for the supply chain and how to make the program work when there's this expectation of bringing partners together around it locally and also just effectively across quite large geographies. Then Anne's going to hand over to me, and I wanted to talk a little bit about the role of the frontline advisor, how important that role is, what they should be focused on, and perhaps some of the things that we can do to help them to just focus on their role in supporting customers into work as effectively as possible. And then we should have time for questions and answers. So as we're talking through, if you type questions in your chat box, Janet will collate them, and there'll be sort of hopefully 10 or so minutes at the end for questions. We'll make sure we're done by 12:30. Just so you're not, obviously with a webinar you can't see us speak, so this picture is here so you know that who you're speaking to. And without further ado, I'll hand over to Tony. How to handle your performance offer. Tony?
Great, thanks Deven. So I'm just going to kick off by just setting out some of the background to the program, which many of you will be familiar with by now, I think. But from asking for your questions and comments in advance, it's clear that some people on the call are coming in as relatively fresher, and so we just wanted to set out a little bit of background first before we get into the detail. I'll then talk a bit about some of the issues around program design, which for those of you who were with us in Birmingham last week will be familiar but somewhat updated, and then move on to talk about some of the performance and financial modelling. So, Work and Health Programme, what is it? National programme, which isn't quite national. It's covering England and Wales, but excluding Greater Manchester and London. For those of you interested in Greater Manchester and London, then you should be you need to, I would suggest, subscribe to URSA's email bulletins for latest updates, but there are supplier events happening in both locations, and those programs are being separately commissioned in the coming months. The supplier event in London is next week. There's also, within the National Working Health Programme, 7 devolution deal areas that have input on programme design and bidder selection. And we think that covers around 1/4 of all participants in the country. The focus of the programme is on out-of-work disabled people on a voluntary basis. This is specifically people who are expected to be likely to be able to work within about a year. The long-term unemployed, which means people who are claiming job seekers allowance or in the full conditionality group of universal credit for at least 2 years. And then also some groups who can be referred early for voluntary more intensive support. Budget is about just over 400 million. It's about 1/5 the size of the programmes it replaces. But on an individual basis, funding per participant is quite significantly higher than the programmes it replaces. So certainly higher program, I should say. So the funding per participant is £2,300. That's to provide up to 15 months of out-of-work support and 6 months of in-work support. By comparison, the work programme had funding of about £1,300 to provide 2 years of support. So significantly more funding on an individual level, but less on a programme level. And that does introduce some quite significant challenges for delivering over very large geographies and in quite difficult and quite complex partnership environment. And DWP anticipate about 3/4 of participants will be from that ESA and disabled group. The department has set out kind of 4 key asks really around tailoring support to individuals' needs, achieving high performance, integrating services locally, and adding value. In practice, I'll talk briefly about what works and tailored support, but this is going to mean far smaller caseloads than is normally the case in DWP programmes, but caseloads that are more comparable in size to the sorts of locally commissioned provision that can often exist in health services, European programmes, and smaller local programmes. I think it's highly likely that successful bidders will be following broadly kind of supported employment principles, so around focusing a lot on vocational profiling, on understanding the sort of the whole person's needs, working with other services, other public services, other services that individuals are in contact with, and taking quite a different approach to employer engagement. So looking at how you work with employers on a kind of employment agency basis, but also on an individual support in work and supported employment basis. And I think there'll be a much stronger focus on engagement and retention in programme. Inevitably, this will be than has existed in the work programme and possibly in work choice as well. I think that, it's highly likely that people will be joining on a voluntary basis. It's highly likely that people may drop out, and so actually having a focus on how you engage people in programme will be key. Performance means, well, it's actually not quite employment entry, it's a measure of earnings, but it's essentially a binary measure. I think the department will also be interested in how people are setting out how they will measure progress towards work and measure progression in work, retention and progression in work. But the performance expectations are very high. They're high compared with the work programme. And the baseline performance is not entirely clear how the counterfactuals for that have been calculated, but they're typically above 30% achieving a job outcome. The third point around local integration is going to be hugely challenging. Services across health, social care, employment, welfare, housing, and a range of other services are often misaligned in their objectives. They have different delivery models, quite different cultures, very different ways of working, and operate under different funding constraints. And this fragmentation of services as well, and quite a lot of confusion about what's being delivered where, and very little coordination and integration of services and public services locally is a very challenging environment to work in. In the devolution deal areas, this will be somewhat easier, but I think even there will be significant issues, particularly drawing out between health and employment. Where it does work, the key ingredients really are around coordination at the management level, so effective local leadership, governance, and the right systems and processes to join up services at a management level, but also critically effective coordination at the operational level as well. So how information is shared, how case work is conducted between teams, and how referral processes and systems work. So really important issues, I think, to unpick, but some good examples that we've built on, I think. In addition, as we know, a wider environment around skills support, devolution, housing. welfare reforms, all of which will have impacts. Final point about added value, this will, I think, fundamentally come down to money and the ability to align other funding streams, other activities, in order to achieve better outcomes and work in different ways. So here's a complicated picture. This is an attempt to try to articulate what the journey through support might look like for individuals and what some of the implications might be or the differences might be with current provision. And I think this will look and feel quite different to previous programmes. Most importantly, because there will be, well, we'll talk about programme delivery in a sec, it's probably most important, but a key difference will be at the point where people enter the programme. So here on the left-hand side, there will be the opportunity for individuals to be referred in through other referral channels, which can be health, housing, local services and outreach. This will mean that there will need to be a process for checking eligibility before people reach the DWP gatekeeper, who will then be the key decision maker about whether an individual enters the programme or not. Now, I think there's probably a risk in over-emphasising how far this will be a kind of a key source of referrals for the programme. Our understanding is the department expects it to be a relatively small volume that come through these independent referral organisations, these separate referral organisations, and that the large majority, more than 9 out of 10, are coming through this blue box DWP referrals. Nonetheless, having effective partnerships locally to identify and engage participants is going to be, I think, a key part of the local negotiation, the local offer, particularly where you're asking local partners to join up and align their services in programme delivery. And I think a key risk for the department and for the programme is that participants will be asking public services to align their provision, their health provision, their housing provision, their welfare provision, but won't be able to guarantee that their customers, if you like, will be able to their clients will be able to benefit from the programme, because this DWP gatekeeper ultimately will control referrals. And it's still a bit unknown, frankly, how that gatekeeping role will work and how these referral processes, non-DWP referral processes, will work. Core referrals will come through, we think, from the ESA work-related activity group or the limited capability for work group and universal credit. And this will primarily be people who are in the early stages of their claims, who have a prognosis of being ready for work within a year or so. But we also expect people to be being referred from the full conditionality group who have a health condition or impairment. We know that triage needs identification and assessment will be a key focus in the programme, a key part of how support is then personalised. And then in programme delivery, likely to be far more personalised and intensive, and the expectation is much more integrated than existing programmes. In the bottom right-hand corner, we've set out some of the additional support services where there's likely to be an expectation that services are aligned, and that applies in work as well. A couple of final brief points. One around employer support. This is likely to be quite different. We know that there are particular barriers, particular issues around employer engagement and support for disabled people in the workplace, characterised by employers having low awareness of the support that is available to them in supporting their workforce, often a high dependence on support services where they do use them, an inability to navigate the system, and in terms of how employers identify and engage with and support their employees, quite variable practice and quite challenging, so quite significant challenges in how we engage with employers to deliver in how employers support individuals in the workplace, both in terms of identifying health conditions and needs and then being able to respond to them and make use of the supports that are available. So being able to demonstrate that you understand those issues and you're able to engage employers in an effective way on a sort of agency basis, I think will be key. And all of this will be underpinned by partnerships and management. So effective management at all levels is likely to be key. I would say right at the top of the list is working effectively with the department and Job Centre Plus locally. So they will be the key channel for referrals, and the programme will succeed or fail on the effectiveness of providers in being able to make that transition work from Job Centre Plus into the programme. So getting the right people at the right time and being able to provide the right support as people transition into the programme. And then a whole range of other management challenges here about how we engage with local partners, with outreach services, with caseloads, with referral systems, with employers, with financial support, and so on. And we've set out some of the previous work we've done evaluating the universal support trials for DWP. We've set out some of the models of how, in particular, these more integrated approaches to referrals and program delivery can work, and some of the challenges in delivering in trying to coordinate support across multiple agencies and channels. The universal support trials were a concerted effort to design locally led trials between Jobs Centre Plus and local government that brought in and used the voluntary community sector and other local providers to deliver welfare and benefit support. So quite relevant in this context. And the other thing, two other things that were key will be the evidence of effective evidence advisor support. I won't dwell on this, but we know that one-to-one regular and timely support makes a big difference, and the smaller the caseloads and more frequent intervention, often the higher performance. Now, no one advisor can do everything, but there's a range of skills and capabilities that are likely to be important here across how we engage with the right people and maintain that engagement, how you motivate participants, how you effectively action plan, how you work in partnership with others, the core kind of public employment service functions of job matching and job brokerage, and increasingly how you manage caseloads, often quite complex caseloads and quite large caseloads. One of the big innovations, I think, in the work programme has been the ability for advisors to manage very large caseloads through sort of technology and more effective management practices. Now, we can't expect one advisor to do everything. So this has implications really for how you organise your service, how you work with supply chains, recognising the department's quite strong push for more effective supply chain for a wide range of organisations delivering in supply chains, and how you manage your contract and your customer journey through provision. And many of the key themes around what works for disabled people will be very familiar to people and really build on that evidence base. So it is around advisor support, but often more specialised and sometimes specialised for individual conditions or individual needs. It's often about, these are kind of supported employment principles really, around whole person support, so raising expectations, but not just for the individual, but also for those people that they engage with, their families and healthcare professionals and others. Effective profiling of aspirations, capabilities and needs, and it's quite different approaches around job matching, employer engagement, as I've mentioned, and support in work. So this includes thinking a lot more, I think, about job design, job redesign, and so on. But there are real trade-offs here between trying to deliver quite narrow and intensive support for a small number of people, which might use things like financial subsidies, quite intensive in-work support, and the commissioning and purchasing of specialist provision, condition management support, for example, versus broader and more shallow models that might rely on more on advisor support. And these are all things we need to work. There aren't right answers on this. Things that need to be worked out through bids. Just a word on the funding model. It's still very outcome-based, but as I say in a sec, our assessment is it is not for providers as bad as it might be. 30% will be on contract value, and good news, that's not an individual attachment fee. It will be a payment made through life of the contract as a proportion of the contract value, equivalent to £700 per participant. And it will be less outcome funded, less outcome based in the work programme. And this innovative accelerator model will mean that providers will be paid more, as many of you will know, providers will be paid more for higher performance on an individual, on a sort of per capita basis. So where performance is, where it approaches and is above the performance offer, the outcome payments will be higher. So I think this could provide an antidote to some of the risks that some participants are parked, because there'll be incentives to work with those further from work. But I think it does also sharpen the performance risk, because the losses from missing targets are proportionately greater. So if you hit 90% or 95% performance, you're losing of your performance offer. You're losing those higher outcome payments. So quite challenging, likely to be quite a challenging model. So, and then nearly finally, these are the shortlisted providers. Many of you will know this already, but almost all of these are providers who are currently delivering the work programme or work choice And the only exception, Economic Solutions, are delivering the Working Well programme in Manchester. So established providers delivering currently established DWP contracted employment programmes. Small number of contract package areas, large geographies, small contract values, which brings challenges. And lastly, the timetable is incredibly tight. So providers are looking to submit their initial stage responses in about a fortnight. They will then be presenting these to the department in March. Shortlisted bidders will be announced in April, and then there will be a competitive dialogue process or commercial dialogue process between May and August, where providers will have to negotiate with and respond to questions from the department. And they'll then submit final offers, and these will be assessed. So go live November 2017. So that's background on the programme. Just talk about the financial model that we've developed. Key contact here who's on the call is Lovedig Vade, our senior statistician. So do please drop me, and there'll be a line, Lovedig the line, if you want to know more about this. So our new working health programme model is basically an adjustable Excel-based tool to enable users to model the finances of the programme. And it incorporates all of the aspects of the specification that's set out by the department and enables providers to input their own assumptions on performance, prices, costs, and then from this generate forecasts of income, cash flow, and profit and loss. So this is likely to be useful either where you're building your own performance offer or to QA, to quality assure internal modelling. So I'm just going to set out 3 slides quickly that show the kind of key programme inputs using the ITT starting points. And all of these can be customised. So the model sets out firstly on volumes, DWP estimates for each contract package area and devolution area, which can be selected from a drop-down box. And then the performance, this then generates essentially the counterfactual performance. I've done it here for Central England. So these then adjust, and the total starters as well. You can then input your own performance offer, or ramp as we put it here. So these are percentage points, so a 5 percentage point offer. You can adjust the take-up rate, that is the proportion of people who go on to attach to the programme, having been referred, and then also make an adjustment for what we've called here leakage, but basically the proportion of people who start the programme but subsequently drop out. Based on this, the model automatically generates an estimate of job outcomes, and then critically you can incorporate a performance scenario so you can see what happens. So essentially, once you have your performance offer, that fixes your standard and your higher outcome payments. So it's key to understand in what scenarios what the impacts are on your finances, your bottom line in different scenarios. So you can adjust this to say +5, +10, -5, -10%. Changes the performance, changes the analysis. There's then a program cost tab. This is got an embedded cost calculator, and you can. This is just showing the kind of key outputs from this, but you can input your own startup, fixed, and variable costs over time and for different groups with a ready reckoner that enables you to then estimate your caseload sizes, advisor volumes, and costs. And this then pulls through to the model summary, so you can separate. So it separates out per participant costs, startup, fixed, and variable. You can compare the average payment per client from the department to the average per participant cost. I've set it up here. Again, this is still in the Central England example, with a plausible margin of about 8%. So trying to deliver the costs for about program for about 2,100 against a £2,300 income. The payment model then incorporates the DWP's design and is based on the performance offer and the CPA. It can then calculate what the outcome payments would be, including the accelerator. And this is just set out illustratively here, so you can see what the standard outcome fee would be, the higher outcome fee would be, the cost per client, the delivery fee per starter, average cost per starter, etc. And as I said down here, you end up with a margin of about 8% in this scenario. On program outputs, again, we've done this illustratively for Central England CPA. I'll run through this very quickly. The model uses the inputs we've set out to show how income changes over time and where it comes from. So this is a kind of impressionist elephant, I suppose, delivery fee and outcome fee. Very different to the work programme approach. Cash flow forecasts. This for me is kind of the nub of the thing. Compared with the work programme, where the program ran at significant deficits for the early years and then surpluses in later years, we think the cash requirement in this program is going to pretty much only fall in the first 9 months and will be wiped out very quickly. And because the delivery fee is a contract-based fee, it provides a lot of certainty around future funding. So this feels a lot more manageable for primes, but also potentially for suppliers, as long as that money is passed down. So there's no excuses, really. I think this will be the department's view. There'll be no excuses for finance not to be passed down to providers up front to enable them to cover their cash requirements and their startup costs. And then finally, the scenario stuff, which is really important and is different to what's available in what can be generated from the tools the department has produced. Generate income and expenditure forecasts at different levels of performance. So in this case, this is showing percentage points across the bottom here, difference, and how the margin increases rapidly, whilst costs fall slightly as a balance between out of work and in-work changes, but not significantly, and sets out, say, payments, costs, and margin. So that's the model in a nutshell. We, of course, there is a catch. So we're very happy to discuss this with providers. We've approached all of the framework providers about purchasing this on license, and the offer is also open to supply chain providers, and obviously this is at a lower price to those who are in supply chains, and includes ongoing guidance and user support. I'm very happy to demonstrate the model. For more information, LV, Luftic, Wave will be more than happy to talk people through it and to demo the model. Thank you. Almost kept to 20 minutes there. Back to you.
Great. Thanks a lot, Tony. I think that the model just helps to explain the finances of the program so clearly and so well. So thanks so much for that. And I think it's best to move on to you next and to have you just talk through the top tips for the supply chain. I'll flick through the slides as you say, but I've just flicked onto your first one now.
Great, thank you. Thanks, Deven. Thanks, Tony. It's always hard to follow Tony because he's just so great in terms of simplifying quite complex policy and program specifications. So hopefully I can follow up quite well. So today, my brief is to talk to you about some top tips, especially from a supply chain perspective. So we've been working alongside Work and the Learning and Work Institute for over 18 months looking at work and health programme. And at PublicCo, we've been lucky enough to work with over 20 subcontractors to help them prepare and get ready for work and health programme. And we've done that in a number of different ways with different subcontractors taking different approaches. And today what we wanted to do was share some of that insight and some of our top tips as we start to prepare for work and health programme with a live bidding round. So the first slide that I'd like to go to is around the key drivers of change and how we think that that's going to impact on supply chain partnerships and how services will be delivered. Tony's gone into detail around work and health programme today, but I just wanted to pick up on the drivers of change and how that might impact on how services are delivered with a supply chain focus. So there's lots of drivers of change. I've listed 3 here today. So the cohort, funding, and emphasis on localism. And I've started to consider what does that mean in terms of how services are delivered, and potentially what does that mean in terms of supply chain strategies for work and health programme. So if I look at those key drivers of change, what do I think will happen with primes as subcontractors? So there's quite a lot of view that prime providers will move towards direct subcontracting, but will also directly deliver more given the fall in volumes. It's a strategy of some, but not all. So for example, in G4S, we can see that they'll usually use their managing agent model, so predominantly 100% subcontracted, but some prime providers will directly deliver in geographies. We also know that work and health programme covers quite complex geographies and with a variety of cohorts, so the ability to draw on specialist skills and specialist knowledge will be critical for primes to be successful. From a subcontractor perspective, we know that the marketplace is competitive. We know that there were some big names that have not managed to secure a position on the umbrella arrangement, and we'll now be looking in the subcontractor marketplace to act as a subcontractor. And that combined with falling volumes will create a perfect competition space within supply chain, where organisations that are perfectly aligned with the spec and are clear in terms of their added value will clearly do well. We also know that there's a focus on service integration and localism, with many different supply chain relationships being created as part of that. We know supply chain integration still has problems, with misalignment of incentives and rewards, cultures and business processes. But there are steps that we can make in the right direction, and we know that a number of prime providers are open to the concept of co-design to make sure that their model builds in the best possible services, but also locally integrates with local services. As an example, I'm working with networks of housing associations across the country to ensure that they integrate with primes to deliver better outcomes for their residents. Localism may be a silver lining for local supply chain partners, especially as that will be a key focus and part of the commercial dialogue with DWP. And we know those with knowledge of local labour markets, initiatives and employers will do well as organisations that have proven specialisms around customers, particularly those in the health cohort with a proven track record of what works, will make a huge difference to work and health programme, with a different number of roles to play, either be it on an end-to-end, a specialist end-to-end, spot purchase, or other arrangement. So although it's competitive, there are opportunities for supply chain partners to get involved. So if you're considering getting involved in work and health programme, what we wanted to do was share some top tips in terms of what do we think the key things to get right are. So there's 3 different areas around what to get right and how to manage the risk of work and health programme. We focused on organisational strategy, the operating model, and also your commercial model. So taking each one of these in turn, in terms of your organisational strategy for work and health programme, it's really key that you understand is work and health programme and any cost opportunity to your organisation. And you know when you'll walk away, we know organisations have already walked away from work and health programme given its viability, but also because of the delivery requirements. So looking at work and health programme and revisiting your bid and no bid decision throughout the process will be critical, especially as this is a competitive dialogue procurement process and more information will emerge throughout the process. It's also key in terms of your organisational strategy to understand why you're doing this and what strengths do you bring to delivery. Are they local? Are they specialists? Or are they added value? And how does that align with primes and DWP specification? A clear strategy will help you inform that bid no bid decision and ensure that you get the delivery that you want. If I move on to the organisational model then, so operating model, there's a number of considerations that supply chain partners and prime providers alike will be asking themselves. Are you clear on the model for work and health programme? It's the most fundamental question. Traditionally, we always think in terms of the customer journey, but work and health programme is a change from work programme to work and health programme. So that means that we need to consider organisational implications, not just the journey of the customer. So what does that mean for your IT systems and your IT teams? What does that mean in terms of your employer engagement, your compliance teams, etc.? And how do you tailor your support to make sure it delivers the best possible outcomes? As part of the operating model design, it's also really important that we're clear on what the primes will do to support delivery and how that partnership will work. We've done a lot of work recently to understand what partnerships and supply chains might look like in the future. So the question will be, how do you embrace and really make that partnership work, and what's the role of the prime provider and how do they see you fitting in? Next questions to clearly think about, and as Tony said, performance is critical in this programme, is are you embracing your discussions with prime providers and are you clear in terms of their expectations, both from the customer service standards to minimum performance levels? And have you had the chance to be able to really embrace the idea of co-design to ensure that those performance levels and customer service standards are influenced by yourselves? Moving on, so we've just seen the financial model that Tony and LV at Learning and Work has put together. It's really important that we input the right information within financial models. So the financial model is only as good as the inputs within it. So have you really fully considered your caseloads, your intervention times, your client expenditure and your performance offered by cohort? They will change, and clearly understanding those changes will really inform how that financial model performs. Tony's touched on it in terms of some of the sensitivities and scenarios that we can run, but do you understand what your model will be most sensitive to? Most likely volumes and achievement and performance. And you're clear in terms of the impact if you fall behind or actually do better than expected. What does that mean in terms of the organisational impact? Lastly and importantly, do you have a process to manage your negotiations and improve offers from prime providers? Moving from a place where you can quickly process those offers and understand if you're taking a fair share of risk and reward. So are you fairly incentivised, but also is the risk fairly shared? So we believe that these three areas are the key things to really focus in on. So if I move to some top tips as you start to prepare for your work and health programme journey, we wanted to share 5 top tips. And these are based on working with the 20 supply chain partners, but they're also based on a breakout session that PublicCo did at the Learning and Work, ERSA Work and Health Programme events. And it's fair to say that these issues came up time and time again. So let me walk you through them. Test your ideas. So DWP haven't clearly defined the delivery requirement. They've opened it up. So that will change by provider, and each provider will have a different interpretation of what's required. So don't just assume that one size fits all. The ability to test your ideas and test your offers and adjust as needed will be critical to your success. So really start that dialogue with your prime providers if you already haven't done so, to understand how are they approaching work and health programs and how can you be part of that process. Prime providers have also been really clear around the importance of evidencing performance, especially if you want to act as a general end-to-end supply chain partner. So be clear about how you can achieve performance and evidence it. Fundamentally, this remains and will remain the ability to achieve employment outcomes. So prove that you can do it and make it easy for organisations to understand how it's comparable to work and health programme. Assuring your offer, it sounds really simple, but this is a highly competitive bidding round with lots of competition. I constantly talk to supply chain partners who talk about copying and pasting responses from expressions of interest that they've written previously for work and health programme and putting it in. I just question, are you putting the best-in-class responses and models in front of prime providers? This is a highly competitive marketplace, as we've already talked about. There are many organisations that have previously operated in a prime space that will now be looking at subcontractor opportunities. Make sure that you put the best-in-class responses, models and expressions of interest in front of your prime providers. If you don't already do so within your organisation, be really clear in terms of internal assurance and red teams to really test your responses and approaches, and where appropriate even consider external investment to get a fresh pair of eyes, because that offer will really make a difference. If I move on to the last 2 top tips that we wanted to share with you, the fourth one comes through the work that I've done specifically around housing in the work and health programme. So it comes around sharing knowledge, innovation and efficiency, and doing that through the process of co-design. Primes will be doing this with DWP as part of the commercial dialogue process, so ensure you do it as well. So this is about 2 organisations coming together to create the best possible service and outcomes for work and health programme participants. So if you've got innovation or efficiency or a different way of working, share that with prime providers and be clear about how it aligns with the DWP specification and how it will achieve that performance outcome. And lastly, but really importantly, move at pace. It's already moving at pace. We're 1 week into a 3-week procurement process. And moving at pace doesn't just mean the governance that you'll be subjecting your offers to, but it will also mean decision making and also responding to expressions of interest requests. With many of those due in this week, I'm sure you're already starting to move at pace to get involved. So lastly, I just wanted to talk about some of the support that PublicCo can help with. So if you're thinking about getting involved in work and health programme and you've only just started that and you don't really know where to start, please do get in touch. Or if you want that as a critical assurance role, please do get in touch with PublicCo. We've got some consultants who are ready to go and support you. So I'm going to hand over to Deven now, who's going to talk about the role of the advisor.
Great, thanks a lot, Anne. Really key to think about how the supply chain all fits together. What I wanted to talk about briefly was the role of the advisor, and I thought I'd start by saying a little bit about, well, first of all, emphasizing that the advisor is just at the heart of making these programs successful. When I set up Policy and Practice just over 4 years ago, the idea was to try and make sure that advisors could focus on the customer opposite them by using software, technology, tools, and a really deep understanding of policy to make sure that they didn't need to try and stay on top of what is a very complex and changing welfare system. You know, if everything else can be made simple to understand, they can focus on the person opposite them and helping that person to take action and make the decisions that are right for them. And it is a very complex environment out there. So as well as the welfare system in itself being incredibly complicated, as well as thinking about the fact that you've got the rollout of universal credit with different people going on at different times, all the way through the length of the work and health program, you've got a whole range of other reforms coming into play. So here in the green, you've got things that are likely to have positive impacts on people's income, so ongoing increases in the national living wage that are expected from year to year, just by example. Changes in the taper rate of universal credit, but you've also got a lot of negative impacts. And I think your advisors need to be very aware of these changes so that they're going to be on the front line of explaining these changes to customers. If they can't do that confidently and competently in a way that really helps them to build trust with the customer, I think there's going to be a real challenge there in terms of building trust. So, for example, a couple of changes there, changes to the two-child rule, whereby you won't be able to receive additional payments for third and subsequent children. You know, that's a very difficult thing to explain, and actually having the guidance there for you will be key. Different challenges for 18 to 21-year-olds. And as I mentioned before, universal credit coming into play throughout. So that's a very complex thing for advisors to explain. What do the DWP expect? I'd say they expect even more of advisors than in the previous program when you think about having to tie into all of that whole web of local support programs. So alongside these national reforms on the previous slide, you've also got a whole range of sort of different local support offers that, again, customers might be able to tap into, advisors might be able to tap into, but they need to be aware of them. They need to be able to point people in the right direction. That's something our software does. So we've been modelling council tax support schemes for over 40 local authorities across the country. We've got the whole of the UK built into our model. We've also been looking at helping them to determine how they allocate discretionary housing payments. So we can determine through our modelling engine whether or not a customer might qualify. Now, you're going to be working with the most vulnerable groups of individuals. There's a likelihood that if they're affected by changes they might be struggling to pay their rent, particularly as people move on to universal credit. Knowing that they can tap into these other forms of support and these other sort of funding streams is a great way to help the customer, help build that trust between the customer and the advisor, and also do what DWP want you to do, which is align these funding streams behind the individual to give them the best possible chance of focusing and moving into work. As I mentioned, the backdrop to this is universal credit. Around that, you've got other things that DWP want you to focus on. So universal support, you're working with the most vulnerable customers, making sure they're able to claim universal credit effectively, budget both upon as they move on to universal credit, but also as they move into work, and also helping them to progress into work. So these are things that I think advisors are going to need to be able to have the tools to think about. Alongside that, advisors need to do what they're great at, bringing it every day, energy, enthusiasm, passion, that commitment to try and transform the lives of customers and program participants is key. And the more they can focus on this, the better they'll do with delivering job outcomes. As I mentioned at the start, Work and Health program is built around the advisor and their relationship with customers. And I'd say that advisors who have more time to work with customers who are engaged and motivated to look for work are going to achieve better outcomes. That's helping advisors achieve that was the foundation of Policy and Practice as a business. What I wanted is for advisors to focus on their strengths, so the people skills, the empathy that they have, the ability to help develop detailed action plans, help individuals overcome the setbacks they're undoubtedly going to face as they try and take those steps into work, and help them to build upon momentum when there are successes. And focusing on those things, helping that transition into work and the relationship is critical. Now, that's hard enough, as we all know. But they're also going to have to, around that, understand and explain a complex and changing welfare system, link into local support, while making sure that the most effective support is what's being offered to the customer. And I think the more help you can give them to do that, the more successful they'll be in terms of achieving outcomes. Now, I wanted to include here just a brief quote from Sean Williams, who many of you will know, formerly Managing Director of G4S's Welfare to Work division. He's an investor in policy and practice, and I thought I'd include a quick quote just sort of explaining why he decided to do that. He started his career as a frontline advisor in Welfare to Work, and he saw how powerful better off in work calculations could be, and how poorly understood they were at the moment. His view was that our work was the best on the market. That's why he's taken that step to invest in us. And actually, we've taken that investment and made significant additional investments in our software, which I'll give you a sneak peek of now. Very happy to follow up. So what we've got here is a system that's fast, easy, engaging, comprehensive, and perhaps most importantly, outcome-focused. It needs to do, it's a better off calculator, so it needs to be an accurate and comprehensive. That's the basic element of a calculator. But just being that in itself, we've learned, isn't enough. So what we've been doing is using the engine behind it to model the impacts of welfare changes on hundreds of thousands of households at any time for local authorities, helping them to target support in advance. We update all of those policies automatically and notify you through the system. And importantly, you're able to sort of dive in and see exactly how a calculation was reached. That's what gives advisors the confidence in the system to be able to use it when they're giving advice to customers. We've made it incredibly fast, incredibly simple, so it's even faster to use than our current Better Off in Work calculator, which was already best in class. Takes as little as 2 minutes to go from initial question with a customer to a Better Off in Work calculation like this, so they can see how much better off in work they would be. We do that by dynamically generating the questions, so advisors are only asking the questions they need to get to the right answer. But we're also ensuring that they're asking the questions they do need to, so it's comprehensive in that sense too. You can save and retrieve cases as caseloads move and people move from one partner to another. And we've tried to make it incredibly engaging and outcome-oriented, so visually being able to see that you're better off in work was an innovation we introduced, again, 3 or 4 years ago. But alongside that, it's tailored to generate the relevant actions for that individual. Linking into local support, one example is as soon as you can see that you're better off in work, that can tie you into universal job match. Like, okay, I can be better off in work. What jobs are there available? You can immediately show that to them. And we've invested heavily in just having a beautiful user experience and built-in guidance built in. I'll give you a quick sneak peek, so hopefully you can still see this. Janet, can you just confirm that's visible to everyone? Probably muted. But here's an example of the system.
Sorry,
so hopefully you can all see this.
Yeah, sorry.
Great. And you can just click in here to see exactly how a calculation was reached. Just one innovation is the ability to show that you can be better off in work, and what we've done is introduce these sliders so you can see exactly how much better off in work you could be. What if you were to progress in work and get a higher paying job? It just automatically calculates the results on the fly. So if you've got people moving into flexible hours work, that's just one innovation that we've introduced of a number of others that we'd love to talk to you about. I'll just talk very briefly about a few of the other benefits. I think Policy and Practice was set up to be more than just a software company. So our analytical services help local authorities to target support and identify and engage the people that can benefit. So for example, people who are affected by the benefit cap, we were able to tell local authorities who those people were well in advance of the DWP. An example of how that might be useful, where those relationships can be built between health and work providers and local authorities, would be to say, for example, and this is an actual sort of screenshot from our service that we provide to local authorities, there are 6 households eligible for, say, the Work and Health Programme around Hanworth Park, and you could, working with the local authority, target information to each one of those households. A couple of other questions we often get. So security is built in, all our surveys are based in the UK, databases are encrypted, we've got advanced user management, so you get clear and accurate management information, but only customers from particular subcontractors can see their cases and their caseloads. Self-service is always key. How can technology be a key part of the program is, I think, something you should try and address in your bid. And our approach to self-service helps save advisors time, but also means that you can upskill your customers. So flicking back to that universal support offer that DWP, I think, will be looking for. And we've got a built-in budgeting tool, so we don't charge any extra. All of the features are sort of built in and customized. I think another big aspect of what we've learned over the last few years working with Serco, G4S, Interserve, and many others is that the software is only as good as its implementation. So we include a standard strong account management, ongoing contacts. You'll have a person who you can speak with. There'll be a chat box built into the software, so if any of your customers have any questions and queries, it was on the slide just before, but you can just type in an answer and you'll get straight to our team, and they'll answer questions for you on the fly. And it's great to have had Gemma Johnston of Serco give us this quote. She was really pleased with, I think, how we introduced the software into Serco and the support they got from policy and practice to bed in the new service, and for that to be ongoing is a great benefit to us as well, because we get to see exactly what you want in the next version of the software, which is exactly what we've invested in, and we'd love to share more of that with you. Janet, do you want to just click through on the poll, which is just to ask you guys and make it a bit more interactive, to ask you what you wish your current Better Off in Work calculator could do. So if you just get that poll kicked off. You have a minute or so. Just over to you, Janet.
Thank you, Deven. Thank you. Yeah, so as Deven says, we have a poll for you here. I'm very conscious of the time, so we'll be quick on this, but we're very interested to know, what do you wish your current Better Off calculator could do? Would you like it to always deliver, and you can answer as many of these that apply, always deliver accurate calculations, be easier to use, provide personalised advice for claimants, offer better account management to yourselves and your advisors, or don't know, looking for inspiration? Thank you very much, everybody, for voting. I can see the results coming in as we speak. I'll just leave it a couple of seconds longer. And
if you want to move on to a question, Janet, just keeping an eye on the time. We've got about 10 minutes left, so covering up as many as we can.
Okay, sure, no problem. There are many questions. Thank you, everybody, for submitting them. Far too many for us to go to. So just to let you know that we will be covering them all off after the webinar with you separately. But first up, how can you deliver? This is the question here. How can you deliver across such huge geographies within the financial envelope? Was the question that came in.
Thanks, Janet. It's Tony here. I can go first. Short answer, given the time. I think it's going to be very difficult, actually. So, and this will be quite different in different CPAs. So if you look at some, like in particular Central, and to some extent Northeast, but mainly Central, I'd say, this feels quite manageable. There's quite a lot of people who would be eligible. The contract size is quite decent, and there's quite a lot of sort of quite urban centres. And actually quite a lot of local engagement involved in the agenda. If you look at others, in particular Southern, but also Wales, always Wales, but I would say Southern as well, this is going to be much harder. Southern, as an example, the concentrations of people who are out of work claiming health rates benefits, claiming ESA, predominantly in deprived coastal towns. So going sort of east to west, you've got kind of Brighton, Portsmouth, Southampton, Plymouth, and then Bristol. Bristol had probably the largest concentration in the CPA. But beyond that, it's predominantly rural areas. So I think it's going to be a few things. One will be about co-location, but integrating services requires more than just co-location. But there'll be a real challenge about trying to basically get access to hot desks, to outstation staff in local authority and health buildings, and relying, I think, on a peripatetic workforce who can move around. But the second will be around looking at some of the innovations in delivering services remotely. In particular, there's quite a lot of good evidence now about computerized and telephone-based talking therapies, for example. And I think a lot of that is equally applicable to advisor support. There's some good evidence that it doesn't work, that advisor support hasn't worked as well when delivered remotely. But I think partly that's because technology has been has been more of a barrier in the past than it is now. So that would be, I think, the answer really. It's partly about outstationing, and that's going to rely a lot on local discussion, and it's partly about looking at more innovation in using technology to reach people remotely.
That's very interesting, Tony. We have another question on technology, which I'll just come back to in a second. But before I do that, thank you very much, everybody, and thank you, Tony, for your answer there. Thank you, everybody, for your poll results. As we can see there on the screen, some very interesting results there. Deven, do you have any comments on those results before I give a couple of more questions.
I'll just make a point about the kind of winning feature. So the ability for software to provide personalized guidance for claimants. I think that's been something that's been at the forefront in our development of this new version of the software. So I'll talk about two specific examples that I think really highlight how that can work. It's really interesting, the intricacies of the welfare system, even with universal credit coming into effect. So I think one example would be thinking specifically about work and health would be to say, make sure that your advisors are aware of schemes like access to work. So if your customer program participant might qualify for this if they were to get a job, making sure that your advisor knows when they're dealing with the employer that the employer can access this other source of funding to try and help secure employment for the program participant, but also help keep costs under control for the employer is just one example. There's another really interesting intricacy that Zoe Charlesworth in our policy team identified, which is to do with the payment periods around universal credit. So if you're also a carer or you have a carer in the household and you're receiving carer's allowance, now that can be paid on a 4-weekly or a 13-weekly period. And which of those you choose has a significant impact on your universal credit payment month to month. The calculator itself suggests, so if that's the situation that you're in, the calculator will automatically pop up with guidance that alerts the advisor and says, actually, you would be this much better off if you switch to a 13-week payment period, for example. So that's just a few examples of how the guidance can be tailored to specific circumstances to deliver tangible benefits to the program participant and really help build that trust between the advisor and the customer. There's many other examples, and again, I think we just need to talk to each one of you on the call about some of the things that are most important to you, and show you how we tackle them.
Thank you, Deven. I'm very conscious of the time here now, and I just want to put this question to Tony and Deven, if I may. One person has said they're interested in exploring the role of technology, the role that technology and IT can play in increasing engagement at lower costs than in traditional models. You've both talked about technology and IT today. Any particular points that you'd like to emphasize for that question?
I just think investing in it is going to be important. Investing in, it's often seen as something that is there to reduce cost, but I think investing in it in a way that helps you achieve better outcomes is going to be critical too. I think the second example I gave alongside the Better Off calculator that I showed briefly to try and help target information to get people to volunteer onto the program is something that has quite a lot of potential, with the caveat of the DWP gatekeeper that Tony mentioned. So although people can put themselves forward and identifying who those people are is going to be key, I think the relationship with DWP will also be critical in doing that. But if you can increase volumes, just think about the potential impact on the performance of your offer overall. And if you can convince DWP that you've got an approach to help them to do that, could that help your proposal too?
Thanks, Deven. Thanks.
No, I'll just say, have a look at some of the evidence around particularly evaluations of computerized cognitive behavioral therapy, which is an area that's been of growing importance in recent years, and think about how some of that evidence can be deployed. But there are things out there. A lot of it, look at Royal College of Psychologists or King's Fund or others, you'll find stuff.
Excellent. Okay, great. Thank you so much. Let me mention, if I may, that I've had Minter from Learning and Work ask me to mention to you that those who attended the Understanding the Work and Health Programme event from January will receive a follow-up report today directly from URSA. So just to let you know that is on your way. In terms of next steps, thank you very much to our speakers today, Tony Wilson, Deven Ghelani and Anne Gregory. We've covered a huge amount, and judging by the questions, there are still a lot more to cover. So as I say, we will be getting back to you all with answers to your questions. So thank you very much, everybody, for a great webinar. We have a very short survey, which we'd welcome your feedback on from what we've covered today, and also give you an opportunity to ask any more questions. And get directly in contact with any of the speakers today. So if you could complete that immediately after the webinar, we'd be very grateful. And also just to let you know that we will be sending the recording and the slides to you after today. Deven, over to you to finish up.
No, thanks very much. Just to say, so thank you all. We'll send around the slide deck with our contact details. All the questions that you may well have typed in will have been recorded. So if we feel we can address any of them, we'll do our best to do that through follow-up. And if any of you would like to have a conversation with us about the items that we've been speaking about, or about your bids in general, you should certainly feel free to contact us if we don't already reach out to you after the call. Thanks so much for taking part and participating. Thanks so much to Tony and Anne for their contributions today. And if you can complete the survey, we look forward to continuing the conversation with you all. Very best.